What do you understand by physical therapy in the field of health? Let's go ahead and define it for ourselves. Physical therapy is the provision of assistance to improve or maintain the physical function of a person in need of care as a result of disability or illness. This definition is not that specific. It could cover just about any type of physical therapy, whether it be for rehabilitation of an injury, muscle building, joint rehabilitation, or joint replacement. It is, however, the type of physical therapy that we are specifically interested in here. Now, with that being said, let's discuss the various types of physical therapy because we understand that there are many styles and methods of physical therapy. 1. Traction therapy is defined as the treatment of skeletal muscles, tendons, ligaments, and bones after they have been damaged or torn. 2. Interlocking therapy is defined as the treatment of muscles, tendons, ligaments, and bones after they have been damaged or torn. This treatment method usually requires surgical extraction of the damaged tissue or removal of damaged cartilage, followed by healing, tightening, and strengthening of the damaged tissues. 3. Reactive physical therapy is defined as the treatment of muscles, tendons, ligaments, and bones that are reactive to mechanical stress. In this type of therapy, the injured tissues are positioned within the bone to reduce stress on the area. 4. Magnetic resonance energy stimulation is defined as the therapy of muscles, tendons, ligaments, and bones that are located near magnetic resonance energy devices that produce electromagnetic fields. This therapy involves the use of non-magnetic force, usually electromagnetic, to stimulate the tendons, ligaments, or bones. This is sometimes referred to as magnetic therapy. 5. Bioelectrical stimulation is defined as the therapy of muscles, tendons, ligaments, and bones that are located near sensors that generate electrical signals. 6. Exercise therapy is defined as the therapy of muscles, tendons, ligaments, and bones that are located near exercises that require exercise to improve the strength, endurance, and flexibility of the tissues. 7. Neuromuscular stimulation is defined as the therapy of muscles, tendons, ligaments, and bones that are located near sensors that produce muscular activity. This therapy is used by neuromuscular therapists to improve performance by strengthening and toning weak muscles. 8. Ligament stimulation is defined as the therapy of ligaments that are located near sensors that produce ligament activity. 9. Tendon strengthening is defined as the therapy of tendons that are located near tendons that require strengthening. This is done by stimulating the tendons with electrical stimulation. 10. Bone restoration is defined as the therapy of bone that is located near fractures that require replacement of bone. This is achieved through the injection of substances into the bone to restore its density and strength. Now that we have the various types of therapies that can be done, let's discuss the different stages of therapy. 1. Active rehabilitation. This is a stage of therapy that involves strengthening and strengthening therapy. This is where exercises are used to increase the strength and flexibility of muscles, tendons, ligaments, and bones. Stronger muscles and bones will increase the range of motion that you will be able to perform. Stronger tendons will reduce your risk of injury. 2. Maintenance exercise. This is a stage of therapy that involves strengthening and strengthening. This stage is done to strengthen tendons and ligaments that have been weakened over time due to poor movement habits or habits of lifting weights. These will help your tendons and ligaments to withstand the rigorous movement that you will be putting yourself through. 3. Rest recovery exercise. This stage of therapy involves strengthening exercises to reduce muscle soreness and stiffness. This is done to ensure that muscles and tendons will function in the best way possible. 4. Deep tissue. This is defined as the stage of therapy where the focus is on strengthening deep muscles, tendons, ligaments, and bones. This is done through exercises that involve the deep muscles, tendons, ligaments, and bones. This will help you to increase your performance level by increasing the ability of deep muscles, tendons, and ligaments to perform the movements. Now we are getting to the point. Which stage of therapy is the best for you? Therapy for flexibility can be used for people in stage 1 or 2 as long as you are very careful to follow the recommendations of the therapist. But there is also an option of transitioning from the active to the maintenance stage. This transition may be done if you are in stage 3 or 4 as you are most likely approaching the end of your therapeutic period. The transition from active to maintenance therapy is often done as a form of progressive exercise. Once muscles and ligaments are stronger, they can be switched to stretch mode to be used for strengthening and stability. The main thing to remember about the different stages of therapy is that you should try to stay in each stage for at least 6 weeks before moving to the next stage. By learning and applying the stages of therapy, you will know what stage your body is in and be able to tailor the exercises that you do in each stage. If you do get to the stage reaching the maintenance stage, remember to do some strengthening exercises as well. This will allow your muscles to stay in the correct condition for the deep stretch exercises to be done. You will see that if you stay in each stage for 6 weeks, you will eventually be able to transition to the next stage and begin to work on some deep stretch exercises. This is a gradual and progressive change process. With all the knowledge you can gather about flexibility, stretching, and deep stretch exercises, you may be wondering what exercises can you do. But you can't really perform exercises. The stretching will do all the work for you. You simply must follow the stretching instructions to the fullest. By following the stretching guidelines, your body will be better able to do deep stretch exercises. This is why you will usually only see people who have been following the stretching guidelines for some time, that is, they have been practicing the deep stretch exercises, that is, have been stretching their body. Thank you for watching. If you got some value from this video, be kind enough to like, comment, share, and subscribe to my channel or leave me your criticism on how to improve my contents.